Welcome back to Navigating Senior Care with Stella. I'm Stella Herrera Williams, and if you're new here, welcome to the podcast where we talk about the real, the messy, and beautiful journey of caring for aging loved ones right here in Austin and the surrounding areas. Today we're tackling Medicare and Medicaid, two programs with similar names that confuse almost everyone. But understanding the difference can literally save your Austin family tens of thousands of dollars and open doors to care options you didn't know existed. No jargon, no government speak, just real talk about what you actually need to know when you're trying to get care for your loved one here in the Austin metro area. Let's dive in. Let's start with the basics because you are not alone in being confused. Medicare. It's health insurance for seniors. Medicare is the federal health insurance program primarily for people 65 and older. You've been paying into it your entire working life. It's not based on income, whether you live in Westlake or East Austin. If you're 65 plus, you generally qualify. What Medicare does cover are your hospital stays, which is Part A. Doctor visits and outpatient care is Part B. Prescription drugs, which is Part D. Short-term skilled nursing after a hospital stay. What Medicare does not cover, and this blindsides Austin families, long-term assisted living, long-term memory care, long-term nursing home care, most at-home care services, custodial care. That's when you need help with bathing and dressing and eating. Let me say that again. Medicare does not pay for long-term care. It pays for short-term rehab after hospitalization up to 100 days with conditions. But ongoing assisted living or memory care in Austin, it is not covered. Medicaid. It's a safety net for low-income individuals. Medicaid is state and federal based on financial need. Every state has different rules, so what's true in California isn't true in Texas. What Texas Medicaid can cover: long-term nursing home care, senior home and community-based services, personal care services, some residential care homes with waiver programs in Texas. Medicaid will pay for nursing home care if you qualify financially. But traditional assisted living and most memory care facilities in Austin is usually not covered. Simple way to remember: Medicare equals health insurance, short term medical needs. Texas Medicaid is a safety net, can include long term care. Most Austin seniors have Medicare, only some have Medicaid, some have both, that's dual eligible. Let me tell you about a call from a Round Rock family that broke my heart. A daughter's dad was discharged from a local hospital after a stroke. The discharge planner said he qualified for 100 days of Medicare coverage for skilled nursing. She was relieved, thinking Medicare will cover for 3 months. Here's what actually happened. Her dad went into a skilled nursing facility for rehab. Medicare paid for the first 20 days fully. Days 21 through 100 required a copay of $200 per day. But Medicare only continues paying if your loved one is actively improving. By day 45, Dad plateaued. Medicare said, "We're done." The facility gave 30 days notice. They owed thousands in copays and had to find new placement because he couldn't go home. The daughter was devastated and confused because they said 100 days. And technically, they weren't wrong, but nobody explained the conditions. This happens all the time in Austin. Here are the biggest mistakes I see. Mistake number one: assuming Medicare covers Austin assisted living. Families are shocked when they learn Medicare won't pay for ongoing care at local communities. Let me give you real numbers. Assisted living in Austin runs $3,500 to $6,500 a month. Memory care is $5,000 to $8,500 plus a month. Medicare pays zero for long-term care. Mistake number two: the 5-year look back. Texas Medicaid looks back 5 years at financial transactions. Families who gifted money to kids 2 years ago, thinking they were smart, get penalized when applying, and they're ineligible for months or years. Mistake number three: not understanding skilled versus custodial care. Medicare covers skilled care, which is nursing and therapy. Medicare does not cover custodial care, which is the help with daily activities. That's what most seniors with dementia need long term. Austin families pay out of pocket or use Texas Medicaid if they qualify. On my mom's situation, my mom has dementia and lives with me here in Austin. She gets home health, nurse visits, PTOT, speech therapy, and Medicare pays for these skilled services. But Medicare does not pay for 24/7 supervision she needs. It doesn't pay me to be her caregiver or for help with bathing. If she needed facility care, we'd pay $5,000 to $8,500 a month for Austin memory care until she qualified for Texas Medicaid or we spent through assets. This is reality for most Austin families. Let's talk about when Medicaid becomes your plan. I've worked with doctors, lawyers, successful business owners whose parents need Texas Medicaid because long-term care in Austin is expensive. Nursing homes run $6,000 to $9,000 a month. Even substantial savings disappears fast. Qualifying for Texas Medicaid in 2025, the income limit is around $2,829 a month for individuals, and the asset limit is $2,000 for individuals. More than this, you don't qualify. You spend down assets or do Medicaid planning with the Texas elder law attorney. What is Medicaid spend down? The term spend down simply means you must legally reduce your countable financial resources to the low limits Medicaid requires. There are two critical ways this happens in Texas. One is asset spend down for those over the $2,000 limit. If you have more than $2,000 in countable savings or investments, you must reduce the difference before qualifying. This is where strategic planning is vital because you don't just write a check to the nursing home until your savings are gone. You need to convert countable assets into non-accountable or exempt assets. The goal is to spend the excess money on things that benefit your loved one but don't count against them, like paying off debt, such as an existing mortgage or credit cards, making necessary home repairs or improvements to the exempt primary Texas resident, purchasing an irrevocable prepaid funeral plan for the applicant. 2. Income spend down for those over the $2,829 limit. If your loved one's monthly income is above the limit, they are still not automatically disqualified. This is a major area of confusion. Texas allows the use of a legal tool called a qualified income trust, a QIT, or something called a Miller Trust. This trust is a special account where the applicant's excess income, the amount over the Medicaid limit, is deposited each month. Depositing the money into this irrevocable trust legally removes it from the accountable income equation, allowing the applicant to meet the income eligibility rules. That money in the trust then flows out to pay the nursing home as the applicant's required monthly copayment, with a small amount kept for patients' personal needs. If you have excess assets or excess income, you need professional help to navigate the spend down process without violating the 5-year lookback rule. What counts as assets? Bank accounts, investments, second properties, extra vehicles, life insurance over a certain value. What doesn't count is a primary Texas residence with an equity of $713,000, one vehicle, personal belongings, prepaid funeral. And it has spousal protections. Texas has protections so the at-home spouse doesn't become impoverished. But it's complex. You need a local elder law attorney who knows Texas community property law. What Texas Medicaid covers in Austin are nursing home care in certified facilities, some home community services that take the STAR Plus waiver, medical care, medications, some residential care homes with waivers. What it doesn't cover is traditional assisted living, most Austin communities, private memory care, and the newer, nicer communities. Reality of Medicaid beds. Not all Austin nursing homes accept Medicaid. Those that do often have limited beds. Some require private pay first. When working with families who need Medicaid, we focus on Medicaid friendly facilities from the start. The Texas Medicaid application. You will work with the Texas Health and Human Services. You will need 5 years of financial records, proof of Texas residency, income asset documentation, medical documentation, legal documents. The process takes weeks or months. Mistakes cause delays. My advice to Austin families: Be honest about finances up front. Don't tour 5 luxury communities before mentioning budget constraints. Know your payment sources: private pay, long term care insurance, VA benefits, Texas Medicaid. Medicaid pending is challenging. Most facilities want approval first or private pay during application. Get professional help. A Texas elder law attorney saves you money by avoiding mistakes. Austin resources I use: the Texas Elder Law Attorneys, Texas Health and Human Services, the local office, Capital Area Agency on Aging, Alzheimer's Association Greater Austin, Dell Medical School Memory Care Program. I help Austin families find communities matching their financial situation: private pay, VA benefits, or Medicaid. My services are free for families. Reach me at 737-389-2130 or email me at stella@stellawilliamstx.com, or you can go straight to the website of tourseniorliving.org to search communities. Here's what you can do today. 1. Know your current coverage. Pull out your cards. What do they have? Medicare, Medicaid, Part D, supplemental, long-term care insurance? Number 2, get the Medicare and You Handbook free at Medicare.gov or call 1-800-MEDICARE, and it's updated yearly. Consult a Texas elder law attorney now, not during crisis, now while you can think clearly. So you can discuss the Texas Medicaid planning, the 5-year look back, asset protection, and spousal protections. 4. Connect with Capital Area Agency on Aging free Austin resource. They know Texas programs and local options. 5. Don't make large financial gifts without advice. That 5-year look back is real. Talk to a Texas attorney first. 6. Keep meticulous records you need 5 years for Texas Medicaid application. 7. Explore Austin resources: VA benefits, Star Plus waiver, CAAA services, Meals on Wheels Central Texas, Drive a Senior Austin. 8. Ask financial questions when touring. Do they accept Texas Medicaid? The waiting list for Medicaid beds. Is there a private pay period required? And the monthly cost. These questions are smart, not rude. Bottom line, you don't have to navigate alone. Elder law attorneys, geriatric care managers, placement specialists like me, we do this daily in Austin. The biggest mistake isn't not knowing everything, it's not asking for help. 3 key takeaways. Medicare is health insurance, not long term care insurance. Texas Medicaid planning requires professional help. Understanding these programs saves Austin families thousands. In the next episode, we're going to go over legal documents every caregiver needs: power of attorney, advanced directives, the HIPAA authorizations, and why you need them before crisis hits. Until then, ask questions, seek help, advocate for your loved ones. I'm Stella Williams with Williams Senior Transition Services, serving the greater Austin metro area. Find me at StellaWilliamsTX.com or tourseniorliving.org. This is Navigating Senior Care with Stella. Take care of yourself so you can take care of everyone else.